morning. My name is Nancy. I'll be your student nurse for today. I'll be here until 7. How are you today?
I'm good. How are you?
I'm doing well. Thanks for asking. May I have your full name and date of birth while I check your wristband?
Linda Ho, May 31st, 1991.
Okay, let me go check your wristband. Perfect. It matches. Miss Ngo, I noticed that you don't have an allergy band. Are you allergic to latex, tape, chlorhexidine, or any other allergies?
Nope, no allergies.
Okay, Miss Ngo, so today I'll be changing the dressing for your central line that's located on your chest, known as a CVAD, which stands for Central Venous Access Device. We do this as per hospital protocol every 7 days to prevent any contamination or infection. I can do this procedure, actually don't need a doctor's order. So I'm going to remove the old dressing, take a look at the site, and I'm going to put a new dressing on for you. Ms. Ngo, have you ever had this procedure done before?
Yes, I have.
Perfect. Do you have any questions for me? Any concerns regarding this procedure?
No questions or concerns.
Okay, and do you feel like you have a good understanding of this procedure?
Yeah, I think I have a pretty good understanding of it.
Okay, perfect. Are you in any pain?
Nope, no pain.
Okay, so I'm gonna go ahead and close this privacy screen for you and gather my supplies. So for this procedure, my supplies will be dressing change kit, CHG stick, bio patch, sterile gloves, cleaning wipes, hand sanitizer, and a mask. I have my mask on, and so does my patient, Ms. Ngo. Now I'm going to go do 20 seconds of hand hygiene and put on a clean pair of gloves. I'll be using this cleaning wipe to wipe down my table for 30 seconds. Make sure I clean the edges as well. Away. Remove our gloves, perform hand hygiene. I'm going to allow this table to dry for 2 minutes. So I want to mention that my patient is in the correct position for this procedure and have easy access to the site. Ms. Ngo, are you comfortable?
Yes, I am.
Okay, Ms. Ngo, if you don't mind, can you turn your head to the left side for me, and please don't move it back. I don't want to risk any contamination during this procedure.
Okay, I'll turn my head.
And please let me know if you have any discomfort throughout this procedure, okay?
Okay, I'll let you know.
Okay. Since I touched the patient during repositioning, I'm going to do hand hygiene again for 20 seconds. Okay, since the table has had 2 minutes of dry time, I'm going to go ahead and grab my supplies now. I'm going to carefully open my kit. Remove things I don't need. Since my patient and I, we have a mask on, I'm going to remove the mask. I'll be needing the sterile gloves. Move this here. So now I'm going to drop in my bio patch. Perfect. I'm going to perform hand hygiene for 20 seconds and put on clean gloves. So at this time, I am going to assess the external measurement of the catheter. I'm comparing to what was previously charted. It was charted at 23 centimeters. I'm confirming that it is at 23 centimeters. We do this because we want to make sure that the catheter hasn't moved, and we also want to make sure that it doesn't move from this measurement during the procedure. I also want to mention that the tubing is not cracked or leaked. It is also clamped to prevent pulmonary embolism. Ms. Ngo, I'm going to go ahead and get started. Please let me know if you have any discomforts, okay?
Okay.
Okay, Ms. Ngo, I'm going to first remove the tape, and then I'm going to remove the tegaderm. So now with the tegaderm off, I'm going to assess the site for any signs of infection. I'm looking for redness, swelling, or drainage. The site appears to be good. I'm going to check again to see if the tubing is cracked or leaked, and it's not. It's also still clamped, and the catheter is still at 23 centimeters. So everything looks good. I'm going to go ahead and remove my gloves, perform 20 seconds of hand hygiene in order to put on my sterile gloves. I want to make sure that I only touch the 1-inch border. And I'm going to release the cuff on this side. Okay, I'm going to remove my trash. Okay, now I'll be cleaning the site and the tube with my CHG stick. I'm going to use my non-dominant hand to hold the tube. Now this hand is no longer sterile after touching the tube. I'm going to activate my CHG stick, crack it. Okay, I'm going to clean the site and the tube for 30 seconds. So while the skin is drying, I'm going to clean the catheter to making upward swipes. I'll throw away my CHD stick. I'm going to allow the site and the tube to dry for 30 seconds. Okay, it's dried for 30 seconds. I'm going to grab my bio patch now. Like a taco. Slide down the tube. Perfect. And I'm gonna remove my tegaderm, the backing to my tegaderm. Okay, make a stress loop. Okay, press down, make sure there are no air bubbles. I'm trying to remove the sleeve bowl. Okay, everything looks good. I'm gonna put tape on to hold down the tube. Okay, I'm gonna initial, date, and the time on my label. I'm gonna put it somewhere prominent so the next person will be able to see this. Okay, I'm gonna get rid of my trash now. Okay, remove my gloves. Perform hand hygiene for 20 seconds. Okay, Miss Ngo, you can turn your head back now.
Okay,
Miss Ngo, how did that feel for you?
pretty good. Thank you for that.
Good. And are you in any pain?
Nope, no pain.
Okay, perfect. Do you have any questions for me?
No, I don't have any questions for you.
Okay, so at this time, I'm going to lower the bed to the lowest position, 2 to 3 side rails up, call light within reach. I'm going to document this procedure. I'm going to put today's date, time, and my initial. I'm going to document that I was the one who performed the procedure. I did the assessment of the site, observed the catheter length, and evaluated the patient's tolerance of the procedure. In this case, there was no sign of infection. The catheter length is at 23 centimeters and it hasn't moved. And Ms. Ngo tolerated the procedure well and had no pain. Thank you.